Hi everyone, my name is Taylor Blazina and I'm a student midwife at the Midwives College of Utah, a certified doula, and a nationally registered EMT. Today's presentation that I will be giving will be in regards to midwives and how they play a role in preventing maternal and neonatal mortality and morbidity. I believe an important part of understanding today's presentation to the fullest would be to understand the terminology that I'll be using. So I think it's important to start with identifying the terms morbidity and mortality. The term morbidity means the condition of suffering from a disease or medical condition. The term mortality, which is a little bit more well known, would mean the state of being subject to death. All right, now that we have those two terms clearly identified, let's talk about the ways that midwives prevent maternal mortality and morbidity. One way that midwives are able to prevent maternal mortality and morbidity is through the use of risk assessments and emotional screenings. These are assessments that are performed throughout the course of prenatal care, starting in the first trimester. It gives the midwife and the client time to chat back and forth and get an idea of where the client is at emotionally throughout their journey. It gives the midwife an opportunity to take this feedback and to assess on a more technical level of how that might be affecting the birther as well as the baby throughout the course of the pregnancy. In order to keep out-of-hospital birth safe, it is crucial that midwives have fairly rigid guidelines for what they consider to be acceptable for out-of-hospital birth. That's why risk assessments and emotional screenings exist, because if any reason there are markers that show that a client may not be a good fit for out-of-hospital birth, it allows time for the client and the midwife to go find additional resources to either implement to make this pregnancy safe for out-of-hospital birth, or to get the client set up to where they can have the birth that they're looking for in a hospital setting with the appropriate resources necessary. Another way that midwives keep maternal mortality and morbidity levels low are through the use of routine vitals monitoring and through consistent lab work. If you were to review a midwifery client's chart, you would see that at some point in each prenatal visit, vitals are taken. These vitals can consist of blood pressure reading, SpO2 reading, pulse, temperature, fundal height, etc. And these markers give the provider a good idea of what the inside of their client's body is doing and how it's responding to pregnancy. Lab work does not have to be done quite as frequently as vitals. Lab work can be done over the course of the pregnancy, on average once a trimester. And lab work is done throughout the course of the pregnancy to show how the body is tolerating pregnancy. Lab work offers a nice, thorough reflection of how the client's body is handling pregnancy internally, and this provides information that the client might not be able to verbalize. Sometimes the client doesn't know if their platelets are low or if they are anemic. The combination of vitals monitoring and lab work gives the provider and the client a better understanding of how the body is tolerating pregnancy and if the client will be a good fit for out-of-hospital birth. The ultimate goal of birth is to be done safely, and so if out-of-hospital birth is not going to be the best fit for your body, it's very important to address this and to go to the hospital when necessary to have the resources available that are needed to give the client that safe birth. Lastly is postpartum care. Postpartum care is essential in preventing maternal mortality and morbidity. Often you'll find that once baby is earthside, that the birther can be put as second in list of priority for care. It's important to remember that both baby and birther are equally important when it comes to postpartum care. If the birther's needs are not being met, it is almost impossible for that birther to be able to meet the needs of their newborn. Maternal postpartum care in midwifery consists of a screening, both physical and emotional, of the client to get an idea of how they're performing postpartum and how they're tolerating being a new parent. It assesses the needs of the birther and makes sure that resources are given to the birther should their needs not be being met. Now that we've taken a look at just a few ways of how midwives prevent maternal mortality and morbidity, let's discuss neonatal mortality and morbidity and how midwives are able to help prevent such. Similarly to maternal prenatal care, routine vital monitoring and lab work can be done on neonates. Vitals monitoring can be done while the baby is still in the womb to a certain extent. This is why midwives, you'll find if you look into a chart, report fundal height at each appointment past 20 weeks, as well as the fetal heart tones. These are done routinely over the course of the pregnancy and consistently throughout the labor and delivery to ensure that the baby is both safe and alive inside the birther's womb. Once baby is earthside, there is a variety of lab work that can be performed in order to assess the well-being of the neonate. This is extremely important because there is a verbal communication barrier that exists between providers and neonates, whereas with your client, you're able to have a back and forth communication on how the client is feeling and how they are doing. Lab work is able to identify any health conditions that may need addressing within the neonate, and then it allows the provider the knowledge to be able to refer out for any additional resources necessary. A crucial factor in preventing neonatal mortality and morbidity is to be trained in neonatal resuscitation efforts. Proper and timely resuscitation efforts can make the difference in outcomes when it comes to birth. Birth is unpredictable, and it's important that midwives at all times are sufficient in these trainings. One way that they're held accountable to that is by having and maintaining a neonatal resuscitation certification as well as CPR. This ensures that if for whatever reason an out-of-hospital birth was to turn into a resuscitation effort, that the midwife and the rest of the birth team would be able to handle the situation effectively. A large part of prenatal care consists of informed consents. Midwives prepare forms that they give out to their clients and they discuss over the course of the pregnancy that identify different ways that the midwife and the birth team will take care of both the birther and the child throughout labor, delivery, and postpartum. By having clients sign and date informed consent forms, you're guaranteeing that both parental figures fully understand their decisions for what is best for them and their child in their situation of birth. Midwifery care acknowledges that at the end of the day, that the parents know what's best for both the health of the birther as well as the baby. And upon educating clients, if they fully understand a situation, they should be in the right mind to make the best decision for themselves and for their baby. To conclude this presentation, let's discuss how midwifery relates to public health efforts. Without diving too deeply into the topic of public health and what all it encompasses, public health is the combination of multiple social determinants of health that make up the health of the public on a whole. While midwifery care is not directly labeled part of the public health sector, it has a large connection to public health work because it satisfies multiple social determinants of health, some of these being education, lifestyle choices, and access to healthcare. In conclusion, communities that have access to midwifery care experience higher quality public health due to decreased levels of maternal and neonatal mortality and morbidity. For those of you who stuck it out to the end, I appreciate you. Thank you. Here's a list of my sources that I used to gather up this presentation's information, and I hope you have a great day.